Namaste. Very good morning, good afternoon, good evening, friends from all around the globe. I'm Radha Paudel, founder and CEO of Global South Coalition for Dignified Menstruation. Now I'm speaking from the Secretariat Office of Global South Coalition for Dignified Menstruation, based in Kathmandu, Nepal. I believe that many of you are aware about Global South Coalition for Dignified Menstruation. It is a global network for changing the narratives around menstruation from hygiene to dignity and 5 days bleeding to life cycle approach. It is initiated by Radha Paudel Foundation in 2019. Right now, we have been working all around the globe through over 85 individual and organizational members. It has been doing online, offline trainings, webinars, campaign, research, publication in multiple languages. Most importantly, Global South Coalition for Dignified Menstruation initiated International Dignified Menstruation Day since 2019. You have seen in my background, the 6th International Dignified Menstruation Day is approaching with the slogan of upholding dignified menstruation fundamental to HRHR. Today is October 18. That means International Menopause Day. International Menopause Day for others, but for the Global South Coalition for Dignified Menstruation, today is the Dignified Menopause Day. If you recall, in 2021, we marked the International Dignified Menstruation Day under the slogan of Dignified menopause is a human right, not a privilege. And that was led by the Scotland, France, and Global South Coalition was working as a technical partner. If you like to get the information, the talks from all around the globe, you can have access in our YouTube channel called Dignified Menstruation. And for us, menopause is very, very important because we believe the dignified menstruation is a life cycle approach. So menopause is one of the important element of the dignified menstruation spectrum. To mark International Dignified Menopause Day, we have a speaker all the way from UK. She is Dr. Jeet Tamang. Let's welcome to her. Dr. Tamang, you are most welcome in our conversation. And I would request you to introduce about yourself very briefly.
Thank you. Thank you. Namaste. Namaste to everyone who is watching this program. And thank you so much, Radha Paudel ji, who is from Global South Coalition for Dignified Menstruation. I feel so privileged to talk in this, really well received, program. I know Radha ji, she has done a lot of things regarding, menstruation, taboo, and I usually follow her. I'm a kind of a fan. It's a really great privilege for me to stand on this platform today to talk about, menopause. My name is Dr. Jeet Tamang. I work as a, general practitioner in Aldershot, UK. For last, I would say like 11 years as a general practitioner, but I've been working as a doctor in the NHS for last 16 years. So I graduated from Bangladesh, Chittagong. Then I went to Nepal, worked there for 1 year as an intern doctor, junior doctor, then came here, started all my process, then started as a junior doctor, then now I've progressed to, the senior GP. So yeah, that's about me. And Dr. Radha Paudel ji has already mentioned really, nicely about like a why we call it a dignified menopause day. So we all, we talk about menstruation, those sort of things, but we don't talk about, the menopause. So I personally always encourage women, to talk about menopause, not only women, family members, everyone, like a work colleague. I always encourage them to talk about menopause. And by the way, just from my experience as well, I'm going through that stage at the moment. So I'm not menopausal yet, but I'm perimenopausal. So in the middle of, this conversation, if you see me flushing or using my this fan, that would be my hot flush. So that's all about it. Thank you, Radha.
Okay, Dr. Jeet, it's very interesting to know. I also in the same kind of phase. I have
Yeah,
still menstruation, but I'm about to have it. So we deserve dignified menopause. This is how we are standing. What does it mean by?
that's correct.
Given your very extensive experience from Bangladesh, Nepal, and UK, and 16 years as a GP in UK, would you explain what kind of patients you have been meeting regards to the menopause? What are the symptoms? What are the complaints they came when they are visiting to you?
Okay, that's really nice question, Radhaji. I mean, when I graduated from, Bangladesh, we talked about, the menstrual cycle, menstruation, all those sort of things in medical school. Okay, so we have never heard about menopause while we were in school. Actually, I went to school in Nepal. I mean, I did my SLC, the school leaving certificate from Kathmandu. So even in our science, we never talked about we knew briefly about menstruation, but we never talked about, menopause. It was considered taboo, talking about menstruation. Then I graduated from Bangladesh in our medical school. Again, we talked about menstrual cycle, all these estrogen, progesterone, all sorts of, the palava. But we never, I mean, we knew what menopause was, but never talked about, what are the symptoms and what women go through, the menopausal symptom. Then I came here again as a junior doctor. We knew about the menopause, but as a junior doctor, mostly it's a hospital medication, the medicine. You don't hear much about, the menopause. Okay. So then I started my, the general practitioner, which is like a family medicine, in 2013 after finishing my, the MD, let's call the medical doctorate, the degree. In those times, menopause, we would see a menopause, but it wasn't talked that much. There used to be a woman, so they will come about, talk about menopause, HRT, but again, at those time, it was not like kind of encouraged. Women were not encouraged to talk about, the HRT, hormone replacement therapy. Okay, but now in the last few years, it's kind of like most of the people, most of the women, they know what it is. Even the Nepalese, the ladies, they know what it is. And there are few who don't know, what it is, but most of the, the ladies, especially our Caucasian counterparts and the Nepalese as well, and other, the ethnicity, they know about, menopause, not in a detail, but they know something about it, and they want to come and discuss with me. And the great thing is, for me, being a Nepalese speaking, and I do speak like a Bangla as well because I graduated from Bangladesh. So some of the ladies, who struggle in English language, then I understand what they're saying, what sort of symptoms, they're going through. Okay. So you asked about, the symptoms of menopause, isn't it? I mean, we categorize the symptoms, two or three categories. Okay. So the first one we call is a vasomotor symptoms. You might be seeing me like a sweating here. So I would say that's a menopausal flushing. Okay. I'm not nervous. I might be a bit nervous, but it's purely my, the hot flushes. I can feel it's coming. So that's how you feel. You feel really warm, especially the top part of your body. You suddenly feel warm. And it gets really worse when you are in certain situation, like, anxiety inducing situation or something like that. Okay. So that's the one of the symptoms, the main symptoms. Then the other thing is the night sweat. At nighttime, you sweat a lot. Some women, they complain like, my clothes are completely drenched in sweat. I can't sleep. And my husband, he's also complaining that you're sweating a lot. And, like they sleep in the same bed, isn't like a husband, the partner. Then what happens is the woman, she can't cover herself with a duvet or blanket, but the husband, he needs, in the UK, it's so cold, so you need a duvet. So there is kind of like a little bit of argument, like I need a duvet, I don't need a new duvet. So same sort, I mean, some sort of, the argument between the husband or partner. Okay. Then the other thing is cognitive, the impairment. That means, you have a brain fog. You feel like, your head is full of, the cloud. You can't think clearly. You can't concentrate. And some women, they also say, like, I keep on forgetting things. I put something, in a certain place, but next time, when I go there, it's not there because she has put it in a different place. So that's a cognitive impairment. Okay. Then the other thing is the mental health issue like anxiety, depression, stress. There are so many things. Then the other one is the genital urinary symptoms. That means, because of the lack of estrogen hormone, so which is the main hormone to make a woman, healthy and feminine. So in a menopause, that hormone level, it goes down. Then you experience these symptoms. So because of the lack of estrogen or the less, the amount of estrogen, the vaginal lining, it becomes dry. Okay. So that can cause a lot of, the pain, discomfort down below in a feminine part. Then women, they complain of, the urinary symptom. They pee a lot. That means the urinary frequency, urgency. If they don't go in a time to a toilet, they can wet themselves. Okay. The other thing is the coughing, sneezing, that can make them, the pee. The other thing is they can get the recurrent, the infection, urine infections, vaginal discharge, vaginal, dryness. And because of that, they have a problem having a sexual intercourse with their partner or husband. That's another major thing as well. Most of the women complain. And I mean, the other thing is the loss of, the libido. There is no sexual interest at all. Okay. So from my experience, I mean, as I say, like my patients, there are kind of a diversity patient. So I have to see like a Caucasian counterpart. That means the English patient. Then I have a Nepalese, Bengali, Indian. So this type of like a sexual issues, it's is mainly complained by our the Caucasian counterpart rather than our other ethnic group. So I know it's about the taboo, isn't it? We don't talk openly about this thing. On top of that, menopause, they don't want to talk about in an open manner. But as I say, we should speak it in an open manner. We need to complain to our, we have to tell it to our friends, family, work colleague, medical professional. We should share all these sort of symptoms. If you're experiencing, I would advise you to go and, seek help from the medical professional. Okay.
Thank you very much for giving the uh, very well explanation. I'm still stuck with your experience. You said
Yeah.
you did not knew much about menopause when you were in medical college since beginning. You know about the what does mean by the menopause.
Yeah.
You know about what kind of medication we need to prescribe or what kind of medical intervention they needed. That kind of things you knew, you learned, but you did not discuss about the socio-political, economical dimensions of the menopause, right?
Mhm.
So, based on your experience, Dr. Jeet, I am still stuck with your explanation.
Yes.
You said you did not knew anything about menopause when you were in school, and
No.
when you were in medical college. That time you only know about what does mean by menopause medically,
Yeah.
and also you knew about the medication, the intermedical intervention for the menopausal patient or clients, but you did not know the social, political, economical dimension of the menopause. So, based on your experience from Nepal to Bangladesh, UK, and experiencing meeting all kind of people, why do not people or medical professionals talking about menopause. What is the underlying cause? What are the barriers? People don't like to talk about the menopause.
I think let me go back to my school days, okay? I mean, as in Nepalese, the educational curriculum in Nepal, we don't have anything about all these. I don't know about now, but when I did my, school leaving certificate, we didn't have anything about, the female reproductive system, nothing about, I mean, nothing about the menstruation, nothing at all. So I used to feel really embarrassed talking about this menstruation thing, with your friend. I mean, even with your parent, I used to feel quite embarrassed talking about it. Okay. So then again, the college, we don't have much in the college curriculum as well. Then went to the Bangladesh during a medical, education years. There was not much about the menopause as a topic. Gynecology, which is the, study of a female health, a female reproductive system. Obviously, there was a term about menopause, and like, what you're expecting, when does it happen, all sorts of things. But even when we qualified as the doctor, we didn't know anything about this hormonal replacement therapy, which is the treatment of the menopause, isn't it? There was nothing in our curriculum in a medical school. But again, I don't know anything about now, but I did my MBBS like 21 years ago, so that was a long time ago. Maybe things might have changed, but in those days there was nothing in our curriculum, so it was not included there. Okay. Then coming to the UK as a junior doctor, you are only in a hospital medicine. So again, you don't get much exposure. Then when we became kind of a GP trainee, there was a talk about menopause. People used to talk about it. We knew there was a hormonal replacement therapy. But again, it was not much talked about. There were not many patients, who would come and talk about openly. So maybe there might be a different, different sort of factors. For example, it could be a kind of a stigma, a taboo sort of thing. There might be that. The other thing is, people maybe like they were not encouraged to talk about it by the medical professional, or for example at workplace by the employer, or there might be a lot of factors. Okay, but this menopause, the treatment of menopause, how it impacts a woman's, the general well-being, these are in talk, in discussion in the within last few years. I would say like maybe 4 or 5 years. And within last couple of years, it's really on the media, celebrities are talking about it. Even like when we see a patient, in our age group, like for example, from 45 to 55, if they have a certain symptoms, like, which is vague, you don't know what exactly is going on, then we talk about, menopause, like, could it be? We do other investigation, but with that, we also encourage them like to talk about, could it be a menopause? So just to kind of give that information to a lady. Okay, but still, like, some of the women, they talk openly about it even in this age, but some of them, they don't talk about openly because they're more focused on other agenda, the other stuff, rather than on the menopause. Because I think personally, if I have to say, my mom, I remember my mom when she went through that phase, like 10, 20 years ago. I knew she was struggling. I could see her sweating, all sorts of things. But at that time, we didn't have any, knowledge about it. I was like 30 years ago. At that time, I was in a medical school. So the thing is, they don't talk about it. Their mom didn't talk about it. Their in-laws didn't talk about it. So they might be feeling like, why should I complain about this? The silly stuff. It's not silly stuff, but it's, they consider it silly stuff, isn't it? I think it might be just one thing is it's for, in an education section, there is not, it's not in a curriculum. One thing is, I find that really interesting. Okay. So that's why there is no education about it, to like students, or like school students or college students. The other thing is, in a health sector, people are focused about other things. They're not focused about the woman, especially, menopause. Other, the female health, they talk about it, like a cancer, those sort of things, but they don't talk about, they think it stays, it's a phase, woman's life, part of woman's life. they will have it and they will get over it, but they don't know like what complication does it have, menopause is a stage. I know it's a phase in a woman's life, very important phase in a woman's life, but it comes with a lot of complication, and it comes with a lot of problem as well. It can affect a woman physically, mentally, socioeconomically. There are so many things, and because of that, it can it can kind of like affect the employability as well, isn't it? There are so many things. So I think it's a lack of education, I would say, in a summary, maybe lack of education and people like not putting like a funding. And the other thing is
Yeah,
the funding. It's a very important thing. So there's not much funding. So I think that could be the possibility, really.
yeah. Thank you very much. I also done, but I'm also coming from the nursing background in Nepal. I did
Yeah.
up to the Bachelor of Nursing. In nursing, I did a Bachelor of Nursing. And later I did a Master in Development Sociology, and also I did the PhD, but it is a different discipline.
Yeah.
I never ever knew about the menopause. We simply consider as a milestone, developmental milestone of the mensurators or goal. That's it. And right now, I have been working around dignified menstruation like around the clock. And I have a strong feeling that it's because of the everyone consider the women's issue. Hey, this is the women's issue, private issue. We should not talk. One thing. Second thing, there is a silence. The women don't have a status at family, at society, everywhere. Their role is like a submissive, and they don't have a voice at all. So there is a deep level of silence, deep level of ignorance, and as a result, even the scientists don't like to discuss about it, don't like to do the research. They
Mm.
did a research for the brain, they did a research for the bone, I mean the orthopedic or so many things, but they don't discuss about the uterus. And I was keep asking myself, when we talk about the menstruation, there is a taboo, there is a silence, there is a ignorance, even though the grandparents, even father, brother, whispered with the mother or with the sister about the new family members whether they have menstruate or not, because they are worried about the marriage, they are worried about the children. If they don't have a children, they would kick out by their husband or family, and they need to take care of their female members of the family. This is how they are worried, and they ask somehow about menstruation. But for the menopause, oh, they done their job, so they don't like to talk about. Neither the family, matron family, nor the husband, nor anyone like to discuss about it. So this is how it is very challenging, I guess. And another important thing here I like to highlight, when we talk about the menstruation, we simply talk about this is the, in positive sense, somewhere some scholars highlighted is the kind of signal, green signal for the reproduction, right?
Mm.
But we
Yeah.
don't discuss the when having menstruation or the hormones which um, occur the menstruation, and is influence from head to that the two in our body, our
Mm.
skin, our brain, our heart, our feelings, emotions, the texture of the vagina, vulva, the skin, everything. Actually, menstruation has impact all parts of the body. But that
Absolutely.
kind of things we never discuss. We simply said, "Oh, menstruation is important. We have to manage it. We should hide it. It is important for the babies, for the reproduction. That's it." But we don't discuss
Mm.
the influence, the roles, the important role, significant role of the menstruator's body. It has everywhere connection. So
Mm.
that part is missing in our entire conversation, no matter whether we are in South Asia or in Europe or UK or Latin America. This is how I see.
Absolutely.
I really like to ask one question with you.
Really. Go on.
you have a very extensive type of patients in terms of the background, economical, social, cultural background, right?
Yeah.
Even in UK, you may see with the refugee, migrant,
Mm.
the so many type of categories of the mensurators.
Yeah.
So, what are the similarities and what are the differences in terms of the menopause?
Okay. All right, so that's a very good question, Radhaji. Okay, so in terms of, I think, similarities is, again, they go through the same symptoms, isn't it? They go through the same symptoms, same age group, all sorts of things. But in a difference, in terms of difference, I mean, the Western woman, I would say like a Caucasian woman. I don't want to put the color there, like a white or black. Let's say Caucasian counterpart or a Western woman. They openly talk about it. Okay, so they're going through those symptoms, not only like a menopause, and any sort of, the health issues, female, related health issues. They will talk about it openly. They can explain their symptoms as well. Okay, so that's very important. In medical section, if you are able to explain your symptoms, then it will be quite easy for the medical professional to understand. Okay, so that's the thing. But in terms of like a non-Caucasian, let's say about, the Asian, Afro-Caribbean, South Asian, East Asian, all sorts of other parts of the world, women, one thing is, there is a language barrier. There we have I see a lot of, women with a language barrier. So because of that, they can't explain their symptoms clearly. So they are having a hot flush. They will tell you like, I've got a fever. Okay, so that's the word they can use. So they can't explain it. So hot flush is a typical word for, hot flush or flash is a typical word to explain that symptoms in it. But in an Asian other woman, they can't explain that. They will say, I've got a fever. And when you have asked them like, what do you mean by a fever? Then they will tell you, I have a fever only this part of my body and I sweat. Then when you look at the woman, when you look at the age bracket, then you start to put things together. Then you ask other questions as well. Then you put things together. Then you will like kind of make a provisional diagnosis. So it could be a menopause. Then you have to explain it to the woman. I think you might be going through a change. So that word again, going through a change is a typical word in how we explain in a Western society. So the woman, they will understand going through a change. But if I have to tell it to a Nepalese lady or the other non-speaking ladies, I have to be really careful to put that word into perspective. So if I tell them you're going through a change, they might be, oh, am I changing into something else? That's why I have to be really careful. Okay, so one thing is the language, the word you use, the patient's explanation, the patient how they communicate. That's the one difference. The other thing is, again, they think, it's not important, menstruation, menopause, all this, they are worried about other things. To be honest with you, they're worried about cancers and infertility, the infertility is not able to conceive, those sort of things. They're worried about it, or irregular period, that sort of thing. They are, really concerned, but they're not concerned about, menopause. And they think, it's just a part of, a woman life. That means, it's going to stop, at some point. So let it stop. Let's not talk about this sort of thing. So I think it's the main thing is it's a kind of education and the language, language education, those sort of thing, that's the main difference between the Western and our, the other part of the world, women, where they come from. So that's what, from my experience, those are the main thing.
Okay,
Similarity
thank
is
you.
all similar. They go through the
Yeah,
same. It's just that they
okay,
don't explain it.
okay. Thank you. And w- you said the similarities in terms of the symptoms. So, do all menstruators experience the menopausal symptoms in the same manner? I mean, the age, or is there any category? Is there any grouping? So, any layman perspective, they can identify the types of the menopause. Can you explain in that way a little bit?
All right. So menopause, it starts from the age of like 45. I'm talking about natural, okay? There is like menopause. I mean, there are two different parts. One is like a natural, and another one is artificial. I don't want to go, to the artificial menopause. Okay, so we're talking about the natural menopause. So naturally, women can have the menopausal or perimenopausal symptoms from 45 up until, the 55 years old. So it's a gradual process. The menstruation doesn't stop all of a sudden. Okay, so you have to go through a certain symptoms, and you go through these, what we call a perimenopausal symptoms. That means your period can be all erratic, all over the place, heavy, lighter, really irregular, those sort of things at the beginning. Okay, and then along with that, you have other physical symptoms, as we discussed earlier, hot flushes, night sweat, all sorts of things. So usually, like average age is from 45 up to the 55 years of age, you will have a different symptoms. Okay, the symptoms, it varies in the woman. Like, say, one woman can't compare her symptoms with the other woman, because other woman, she might not experience anything, or she might experience very little symptom, but other woman, she might be experience a lot of symptoms. So you can't compare yourself with other women. Okay, so, and up until like a 55, by the time you're 55, your menstruation will stop. Okay, the average age in UK to go through a menopause is 51, but I think in Nepal is a 48 or 49, 9 years old. Okay, so I would say, like, from 45 to 55, you will experience some sort of symptoms, with along with, the irregular periods and all those sort of things. Okay, and some women, they can have an early menopause. That means, like, if their menopause, menstruation stop for the age of, the 45, then that's called the early menopause. Okay, then there is another thing called the premature menopause. So premature ovarian failure, so that happens before the age of 40. So I think that's kind of it's more pathological rather than the natural. So it can be artificial, some sort of cancer that can cause it. So the average naturally from 45 to 55, we don't have a categorization, but what we say is we call perimenopausal. That means you still have a period, but you're going through a certain, your changes, like your experience of symptoms. So that's called the perimenopause. Okay, so menopause is after the last menstrual period, you have no period for 12 months. Then you can say, like, you've gone through a menopause. Okay, you're menopaused. So after that phase, your menstruation has finished, then 12 month no period, then after that you call it postmenopausal. Okay, so that's the category, really, the perimenopause,
Okay,
postmenopause.
thank you. Okay, Dr. Jeet, can you little bit highlight about the menopause among the menstruators like lesbian, bisexual, trans men, queer?
Okay. All right. That's very good question, Radhaji. Okay. So I've got, like, as a GP, we do have a diverse, population of patients, isn't it? So I've got a few, queer, lesbian, patients who are, in that age bracket, who is going through a menopause. The good thing is, I know their sexual preference is, different, but at the end of the day, they have to go through the same sort of, the nature's call. Let's say nature's call. Is menopause is also a nature's call.
Yeah, I
So,
love it.
a good thing is, they talk about it openly. So I know they're lesbian, but at the end of the day, they're women. So they talk about it openly. And I've got, like, few patients in that age group, and I have started them on a HRT, the hormone replacement therapy, because of their, the severe menopausal symptoms. So they talk about it openly. Okay, so that's that. And the other thing is, like, there are few trans women, but they are, like, female to male. I mean, there is a F to M and M to F, isn't it? So especially female to male, they are. I mean, they're genetically, like, they're born women, but they're changed into men. But usually, I mean, it's like they have a hormonal treatment and all sorts of things. So that's why they don't experience menopause as such. But because of the hormone, they go through a similar sort of a menopausal symptom, because the hormone is suppressing their the natural, like, a menstruation, isn't it? And sometimes they do have a hormonal side effects, which can be similar as a menopause, but it's quite complex for a GP, because we are a general practitioner. So that's why they are under like a, specialist team. But I have seen like a few patients, they come to us asking like what it could be. I'm on a hormone, so could it be a, hormonal side effect? And listening to them, it sounds like, the artificially, because of the hormone, they're going through that. But yeah, lesbian ladies, they talk about openly, and they are happy to accept the treatment like a hormonal replacement therapy, so which is good. So they don't consider it a taboo. They talk about it openly.
Wow, it's very inspiring.
Yeah.
Usually, we don't think about the LBTQ group about the menopause. And likewise, do you have a patient with autism or other kind of neuro disorders?
Yeah. Yeah, I do. I mean, we do have a patient of like learning disability, those sort of patient. Again, they go to the same sort of symptoms, but the thing is they can't explain it.
Mm,
They- that's why, we don't know whether they're going through, menopause, because it's a menopausal symptom is you will know when they will tell you the symptom, isn't it? So without, if they don't tell us, then obviously we won't be able to know whether they're
yeah,
going through menopause
true.
or not. But what we do is, that age, the menopausal or perimenopausal, that phase is very important in a woman's life. It's not only about, the menopausal symptom. As I said earlier, it comes with a lot of complications, a lot of, there are risk factors. For example, cardiovascular disease risk, heart disease,
Mhm.
diabetes, high blood pressure, cholesterol, these all sorts of things also can happen during this stage. So we have to, as a GP, as a family the practitioner, we have to like think about these, in this group of patients. So we have to check cholesterol, diabetes. We need to make sure their blood pressure is in, right target. The other thing is, we also talk about healthy lifestyle,
Mm,
because one thing is they don't follow the healthy lifestyle because of their condition.
mhm,
On top of that, if they're going through a menopause, then obviously the risk is very high. So we need to. That's why what we do is we do something called a learning disability health check. It's a part of our the GP care package.
mm,
So once a year you have to invite these patients to go through all these health condition. And obviously when you do the assessment, we see lots of like a menopausal woman, the ladies with the the problem, again with the learning disability, they're not able to tell. So it's a holistic, the assessment we do.
mhm,
And the other thing is the cancer screening is very important, because
mm,
again the cancer risk is very high in a perimenopausal, menopausal
mm.
woman, like breast cancer, cervical cancer, womb cancer, those sort of things. So again, we go through the risk factor. So it is quite difficult in this age group, especially if they have a neurodiversity or learning disability. It's quite difficult to identify these symptoms or diagnose these condition. But again, it's just a holistic assessment. We have to do it
Thank
as
you
a
very much. It's very, very important. And usually
yeah,
we don't touch this kind of issues while we talk about the menopause. So, regardless of the identity, what should do by the menstruators or menopausal woman or the menopausal person um, in terms of the individual level? Do you get my point?
yeah, yeah.
So all the time, menstruators don't put the priority on themselves. They put the priority for their partner, for their children, for their someone, right?
Yeah.
So what would be her or his responsibility to take care of during the menopause?
Okay, that's very good question, Radhaji, again. So first thing is, education. And, education is very important. You need to know what menopause is and what kind of symptoms you can have. Okay, so that's very important. I always tell my patient, when I see the patients and they talk about, these things, I try to educate them, like, what is menopause and what are you going to expect, during this phase. So that's very important. Okay, so you need to know about it. Then the other thing is education, not only the woman, then the other people, around the woman, like a family, the children. It's very important. Husband. That's most important, because I've seen some of the women's marriage or relationship falls apart because of the menopausal symptoms. They go through a lot of things and the partner doesn't understand, family doesn't understand. Then what happens? They go through like a lot of, the marital issues, relationship issue. So that's why it's woman, first thing is woman, she needs to educate herself, empower herself. Okay. Then the second thing is she needs to educate, or the other people around her also needs education. Okay. Then the other thing is woman needs to talk about it, openly talk to, the family member. Tell, if you're going through symptoms, the menopausal symptoms or perimenopausal symptoms, don't keep it to yourself. Okay. Talk to your family, your friends. Don't feel embarrassed. Don't feel, you're going to be judged because of this. As I said earlier, some women don't the other thing is, I will always tell women, don't compare yourself with the other women. Okay. So your mom, your in-laws might not have experienced this symptom, or they might have experienced, but they might have hidden. But you're not your mother, or you're not your mother-in-law or your other in-laws. Okay. So you is yourself. So look after yourself. You have to, you have to talk to your, openly talk about it. I'm going through this thing, I'm having a problem, so I need a help. That's the most important thing. Okay. So if you don't ask, there is a one saying over here, we use that quite a lot, especially among our, the Caucasian friend. If you don't ask it, you don't get it. Okay. So that's the one thing I've learned coming to you. If you don't ask it, you don't get it. So that's true. So if you're not asking help, you're not going to get a help, right? So that's the other thing. Then the other thing is, you need to talk with your employer as well. So other thing, the women in this age bracket, most of them, they're working. They're employed. Okay. So they're struggling at work. So speak to your employer. Nowadays, there is a legislation in the UK. It came in February 2024. If your employer is discriminating, because of your menopausal symptoms, or you're like a kind of a not able to perform at work as you should be, and your employer is, kind of harsh towards you, that's the discrimination against, your sex, and your like, what do you call them? There is a legislation actually. So that's why, if you're having a problem, talk to your employer. They can also do some, the workplace adjustment. So that's why talk, so educate yourself, empower yourself, and talk to your, loved ones, your employer. It's just education, talking. That's it. It's simple. I know it's easy for me to say it's simple, but I know it is hard. I mean, as I said, going through a same sort of problem myself, I find it hard, sometimes explaining my loved one. You feel like, I know it's my problem. Why do I bother? Why should I
Mm.
bother them? Sort of thing. But don't feel embarrassed. Don't
Mm.
feel you be judged. Just speak to them. Tell them.
Okay. Talk, 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 talk. Right? This is a
Right. That's
very
very good.
good formula
Yeah,
to
that's
create the enabling environment for dignified menopause. Let's
absolutely.
let's imagine that I am the menopausal person and I'm asking for the help. So, what would be the role of my partner or husband, and what would be the role of my children or other family members?
Okay.
Would you share a little bit about the tips about
Okay.
it?
That's very good. Okay, so first thing is, like, woman goes through a lot of symptoms. Okay, so as we already discussed, hot flush, night sweat, they can't sleep. The other thing is the sleeping problem is very, very kind of it's quite troublesome. A lot of women, they feel like they will tell you, doctor, I'm feeling like I'm going crazy because I haven't slept for last 3 days. The 3 nights.
Mm,
So the reason that why they can't sleep is because of the hot flush and night sweat. On top of that, they have the lack of sleep. Then the other thing is, their husband, kind of like they sleep in the same room. So the woman, they need to ventilate their room. Okay, they need to keep their room cool. But if they're, sleeping in the same room, the husband won't let kind of open the window, or kind of there's so many things, and that creates. Okay, so that's why husband needs to understand your wife is going through a menopause. She's having a night sweat, not able to sleep. So let her give a space actually. Okay, let her allow her to ventilate her room. Okay, so if possible, let her sleep in a different room, because some women they tell me, I want to sleep in a different room because one thing is I'm struggling with this symptom. I can't sleep. My husband snores on the other hand, middle-aged man, usually like the middle-aged man, pot
Yes, yes,
belly,
yes.
chubby, they start snoring, and that makes, that's the other thing, they can't sleep. And I want to sleep in a different room. But my husband doesn't understand. He will tell me, like, you want to sleep in a different room because you don't like me? You have
Mm,
stopped loving me? It's not that. It's just woman is going through a lot of things. So let her give her a space, okay? So it
mm,
might last for a few years, and after that, again, not sleeping in a same bed, that doesn't mean
mm,
she doesn't love you. She still loves
mm,
you, but she's going through a hard phase. So give her
mm,
a space, okay? That's all. And I understand her, okay? So one thing is the woman, what I've seen is, especially in our Nepalese community, how we do our housework, isn't it? Men does, housework, but not as, much as women. So they go to work, they come home, then they have to do their housework as well, okay?
mm.
So you mentioned about the children as well, isn't it? So the
Yeah.
children, is they put a pile of, the dishes or pile of clothes there. So don't do that to your mom. She's struggling. So help her. Just wash
Mm,
the dish, just divide the chores among you.
mm,
Husband help her. She goes to work, you go to work. So come home, share the, share the, what do you call, the burdens amongst you. So that's all other thing. Okay. Then the other thing is, pamper her. Pamper your wife, take her to spa, take her on a nice holiday. It doesn't have to be expensive, but just go out on a date, kind
wow.
of a romantic. And the other thing is, the women, they lost libido, isn't it? They don't have any sexual, the feeling. It's not
Mm,
because she doesn't love you. It's because, she doesn't have that interest because of the lack of hormones. So
mm,
understand her. I've seen, like, marriage falling apart because of,
mm,
the menopause, because women, they
mm,
don't like to be physical, isn't it? And the men's hormone is different. So
mm.
different than the women. And because of that, there is men, I'm being honest here, okay? So
Yeah.
men can't find something with their wife, then their mind wanders, isn't it? And that cause the other issues, the marital issues. So there are so many things. So understand your woman, understand your mom,
Understand.
understand your in-law. So I'm sure there are
Mm,
like a lots of, like, the jethani, what do you call it in
mm,
Nepali, like in-laws, isn't it? So
mm,
understand her, because we live in a, like, a connected family, isn't it?
mm,
That's why understand her. Just understand her and
mm.
help her. Talk to her, okay, and talk to her. Share things, share the house chores. Yeah, that's what I would say, really.
Thank you very much. I also received so many calls from both um, wives and husbands or partners' side. Oh,
Mm,
my partner or my wife is changing dramatically. We spent like 3 decades and 4 decades, and mm, she doesn't like to talk. She doesn't like to share. She's becoming different person nowadays. So that kind of complaint I keep receiving, and it's just sad that the husbands or partners are very much educated. They are leading the big position in organization, big organization, but they are not trying to understand the menopause and menopausal symptoms and their role, to support their partners and wives, because menopause is not like the permanent one, is a temporary thing, and it's
absolutely.
like a heal if we take care well on time, right?
Yeah,
And that part is very very important, and I always worried how could we engage the school children, since the school age, so they could be the
absolutely.
best partner in future. Okay, Dr. Jeet, we don't have much time. Can you little bit explain? Earlier, you talked about there is the employment policy for
Mm,
creating the dignified menopause environment at the workplace. There is a
mm,
policy that the menopausal person know about it, but
mhm.
what would what kind of role should play from the organization side, I mean the employee side, having the policy is not getting the relief or support, right? So
No.
if I'm seeking the support, what should look like?
Okay. So I think the first thing is, the women, they need to, if they're struggling, they need to speak to an employer. Okay. So just openly tell them, like, I'm having this problem, especially like, most of the women, they struggle with a hot flush. Okay. So hot flush, brain fog, they can't concentrate, in a project or task, those sort of thing. And lack of sleep again, because of the lack of sleep, they can't kind of put their 100% at work. So there are so many things. Okay. So if you're struggling, tell your employer about it. Okay. So the employer, so there are a few things employer can do. So one thing is talking to a woman who's going through that sort of problem. Then the other thing is just what sort of help she needs. So especially if they're struggling with the hot flushes, then obviously provide a fan, good roomy space, give them a time to kind of take a break at work, at certain time, give them a quiet space. There is a quiet room in most of the workplaces. So I've seen in few office, the high profile office, they have a quiet space. They can go and, sit there, especially if they work in certain environment where they have to work, wear a certain, the uniform, then, make an adjustment, let them wear like whatever feel comfortable. Okay. So especially like a woman, first of all, they need to, as I already said, if you don't ask, you don't get it. Okay. So ask help. Then your employer will do these things, and it's written on the legislation what sort of reasonable adjustment does the employer needs to make, especially like workplace adjustment. And sometimes the employer can allow women to work from home as well, what we call the remote working, if that's possible. Obviously, as a GP, we can do a remote working, but in a certain situation. But again, there are so many things the employer can do. The other thing, if the woman, they are really in UK, what we do is, like, if a woman is really struggling because of the menopausal symptom, then if they come to see me, what I do is I just sign them off. What we call is a sick note. We provide a medical certificate saying, this woman, she is going through certain things. Can you give her some time off? So that's the one thing. Then the other thing is, they may be fit to work, but can you make this adjustment at work? For example, shorter working hour or workplace adaptation. So
Mm,
there are lots of things we can do here in the UK. I'm not sure about in Nepal and other countries, but in the UK, there is a lot of, the things that have changed, for menopausal women. Since these talks are going on, and change in employment, all these legislation, so a lot of things has come to into women's benefit, actually, so which is good.
yeah, thank you. In Global South Coalition, we keep saying or demanding dignified menstruation friendly workplace. That means
Mm.
flexible working hours. If required, the organization has to provide the facilities for the counseling of occupational therapy, alter the job, and also changing the accommodation, like providing the ventilated room or extra fan, something
Mm.
like that. And even the menopausal women or people may have the sudden bleeding, so available of the menstrual product as their choice, or resting rooms, something like that. We keep demanding with the organization as well as the policy. So
Mm.
we are really at the end of the time.
Mm.
Before closing, dear audience, whoever from where watching us and will be watching later, please keep watching and keep making the talk about the dignified menopause. Talk with your
Talk, talk.
friends, with your partners, with your husband or wives or in-laws, or at workplace or community, with the religious people, wherever you are. Just make a talk. This is the natural call, and we should not escape. If we are escaping from this, we are violating their human right, and it's a domestic violence or gender-based violence too. So if you are really looking for the justice, if you really looking for the peace at your family, at your workplace, please have a talk on dignified menopause. And upcoming December 8th will be the 6th International Dignified Menstruation Day. And I encourage each of you to organize any kind of activities, whatever possible from your side. Please do, and don't forget to make a hashtag Dignified Menstruation and hashtag Dignified Menstruation 2024. It is easier to track where you are and what kind of activities you have been doing. And if you need any kind of help in terms of the content, design, or advice, please visit our social sites. We keep sharing the information like toolkit, concept note, and also the sample for the social media campaign. Uh, uh, you can visit dignifiedmission.org, or you can write. We can reach out directly with me. And our website is launching in 4 languages: Nepali, English, Spanish, and French. Please feel free to reach out to us. And Dr. Jeet, thank you very much for your very, very much precious time. And it's a great honor to have you in our conversation. And we feel like you are our collaborator, you are our partner. It is not enough. We need to have another session. And I like to have you in many conversation in UK, in Nepal, in somewhere else. We don't know. We are working at the global level. And I would like to, before ending, I would like to invite you to give a final message for this webinar.
Okay, thank you, Radhaji. First of all, giving me this lovely opportunity to talk about this the menopause. Personally, going through the same phase, I feel deeply connected with the women who are going through the same. So it was a great pleasure to speak to you and hold like a in this platform about this a passionate subject with you. So I'm really grateful for that. Sorry about the disturbance. But yeah, that's all. So I would say, women out there, talk, talk, talk. Everyone talk, talk, talk. If you don't ask, you don't get help. Okay. So if you ask, then you get help. So that's my husband. He brought me a cup of tea. So he knows what I need.
Yeah.
That's it. That's it for today.
This is very good to know that we need a role model, real man, real husband nearby us to have a dignified menopause life, right?
That's correct. Absolutely.
Yeah.
Absolutely.
Thank
Yeah.
you very much once again to Dr. Jeet and each of you, and keep follow us. We keep talking through the webinars and social media. Have a good night, good day, and good morning, friends. Bye.